A major announcement made this Independence Day by the Prime Minister from the ramparts of the Red Fort was the unveiling of the National Health Digital Mission. And a part of this mission sees every Indian having a digital health ID. This is simply an ID card or an ID number which, when accessed, gives access to your entire medical history, even from birth, if that data is available. So it means that every doctor you visited, every diagnosis that you received, every prescription that you took, every test, every surgery, every operation, every procedure will all have a record in one place that any doctor can access if required. Now, how will it work and will it be safe? So what this project says is that all of this data will be secured only by you. Anyone can access it only after you give explicit consent, and that too they have access for a limited period. It is voluntary to get this health ID card, and it's also voluntary to attach it or link it with your Aadhaar. You have to link it with your Aadhaar mandatorily only if you are taking any kind of government service. So the first pilot project rolls out from the end of August. It's believed to be rolling out in union territories first and then will be scaled up. Will it be implementable though? So in a conversation that I had with medical experts, they say implementation will be challenging and also the key. Initially, we may see government-run medical institutions and organizations take this up rather than private ones. Private ones usually, especially in big cities, already have a data framework in place where they record every kind of treatment, prescription, etc. that they give patients. What will also be a bit of a challenge is actually uploading all of this information onto a cloud-based kind of system. We cannot really leave it to patients to do that. They may not have the know-how, they may not have the accuracy or the capability of uploading all of their own information. That means it's left to the doctors and to the hospitals to make sure that there is a record somewhere of all of the procedures, tests and care which has been given to these patients. Now, this could be difficult to implement in a large part of India where there may not be access to a computer, there may not be access to a broadband or even technical know-how among the doctors to do this. Another challenge that doctors face, and which is why initially there has been some resistance from the medical fraternity, is that they simply don't have the time. That's what they say. In very busy practices, when you have 50 odd patients in a day, you might have to spend an equal amount of time actually uploading all of their data. But experts also say that this is the only way forward. There is no way around it, and it is something which can actually save lives. If a doctor has a patient come in an emergency situation, they can access all of their history because of this one ID, and it will help them make the right decision, the right diagnosis, and possibly save more lives. It also places a greater responsibility on doctors because all of their medical decisions will now be on record. So of course, a digitization of health or a health ID does not replace all of the problems that the Indian health system faces. We need more doctors, we need more professional know-how, we need more doctors in remote locations of the country. All of those problems still remain, but this is definitely a step in the right direction where at least we are moving with the times and we can have more transparency and access to our medical records. What's important is that that data remains safe.